There's a mental health crisis, decades in the making, facing our children. This crisis has been heightened by the pandemic. Our children, our communities, and our future are at risk.
We do have a crisis on our hands, but the struggle has been not just against COVID. We've also seen amplified during this period of time children's mental and behavioral health needs. Having the capacity to recognize, prevent, and care for those needs, we believe, will better improve the opportunities and outcomes for our students.
Here at the University of Oregon, we dare to reimagine a new model to better serve the youth of Oregon and beyond.
We are aiming for nothing less than transformative change that we hope will eventually reach every child in Oregon.
Providing our state with a new level of behavioral health professionals and accelerating development of leading-edge interventions. This transformational effort provides a $100 million endowment for scholarships, aiming to infuse public schools with 200 graduates a year, diverse practitioners for diverse populations, ready to deliver science-based early detection, prevention, and treatment strategies directly into the lives of children and families. The Ballmer Institute for Children's Behavioral Health at the University of Oregon. It's a bold vision that signals it's time for us to act for the future of the state and the world.
We are announcing an amazing gift to fund a Portland-based institute of the University of Oregon on behavioral health for children. This gift is from Connie and Steve Ballmer, two amazing philanthropists, and it's more than $400 million. The Ballmer Institute for Children's Behavioral Health is an amazing addition to what the University of Oregon does. For a number of years now, we have been thinking about how we can make an impact in the state, how we can serve the state. And there's no more important way for us to serve the state than by dealing with a crisis that is affecting countless children in K through 12.
When Steve and I founded Ballmer Group Philanthropy, we wanted to support efforts that helped kids and families. The one constant issue facing children and families around our country was poor behavioral health. And that was before COVID, which then inflamed this crisis like nothing we've ever seen before. A most immediate need is around the topic of workforce. How do we recruit, educate, and certify more people to help address the crisis? Thankfully, Oregon's had a great plan. We were impressed with everything that U of O brings to the crisis. Its deep faculty expertise and working relationships with government agencies and schools, and probably most importantly, a sense of urgency.
With the support of passionate, talented educators, these students will be ready to pursue careers and jobs in this field. I want to emphasize that the results of this program will be statewide, starting in Portland with the proximity to school districts which are super supportive of the work.
Hey, thanks to everybody who has worked on this project to make it happen. We are behind you and cheering all the way.
Go Ducks!
As a public research university, it's really important at this moment in time to really think about what our role is, not just for our students and how we fulfill our research and educational mission, but how we make an impact in the world. And as the University of Oregon, how are we also a university in Oregon and for Oregon? And this is a great example of that, where we can take our world-class expertise that we have and then bring that to help the lives of students throughout the state. So we're really trying to do something ambitious, and that's going to be a challenge, but that's the challenge that we're really excited to face.
20 years from now, my hope is the Ballmer Institute is able to radically improve the behavioral health of children and youth in the state of Oregon and beyond. Through these partnerships, we're able to test interventions, train the next generation of leaders in behavioral health, and make an impact that we wouldn't have normally been able to do in our siloed services of care and our personnel preparation programs that have lacked a certain level of innovation. Here and moving forward, we'll be able to train the next generation of behavioral health providers in a way we haven't done before.
Developmental scientists have done a fantastic job of teaching us about the importance of the first 3 years of life. But when it comes to the mental health challenges, the behavioral health problems of older children and adolescents, sometimes I think as a society we're too quick to throw up our hands and say it's too late. This amazing investment recognizes it is not too late.
We've arrived at a solution that excites us, and that is to create a new profession. This, we think, is the breakthrough workforce intervention for improving behavioral health outcomes for children and youth.
This is something that's based in the community with a combination of both research and clinical faculty that will be providing experiential opportunities for students to do clinical training within school environments. So that's something that we do bits and pieces of, but the scale and intentionality here is completely unique and something that we've never done before. And I think it's going to be a national model for other schools as well.
Hi, I'm Toya Fick. I'm a member of the Board of Trustees and the Oregon Executive Director of Stand for Children. STAND is an education advocacy nonprofit that works relentlessly to ensure our students have what they need to thrive. As a parent, as an education advocate, and a trustee, I could not be more delighted to support the Balmer Institute for Children's Behavioral Health. Right before COVID, my organization worked relentlessly to help pass what's known as the Student Success Act. We worked with the legislature to get this legislation across the finish line because we heard from so many parents and teachers and students themselves that our schools need the financial supports to provide mental and behavioral health for our kids in a school setting. That legislation provides the financial resources. The Balmer Institute will help provide the human resources to ensure our kids have what they need in school settings across Oregon and across our state. So again, I am thrilled to support this initiative. Thank you to Steve and Connie Balmer and to the U of O for having the foresight to meet this need. And most importantly, go Ducks.
This kind of social impact simply would not be possible without deep partnerships and authentic commitment with the state, with educational systems, with the healthcare system, and with communities, especially those that are struggling the most.
I'm excited about this partnership with the Balmer Institute. It goes beyond the traditional public school district college partnership. You're taking a leading university program, well respected and regarded for its work in behavioral health, and you're working in symbiotic ways with a pre-K-12 school system like most that has a dire need to bring on campus a capacity for preventing and caring for the mental and behavioral health needs of kids. I can't think of a more important resource right now to support our children, youth, and educators on campus than engaging in this partnership.
My interest in children's mental and behavioral health was really strengthened during my time as a classroom teacher. So in that position, I quickly came to realize that my students not only needed academic support from me, but they also needed social, emotional, and behavioral support. And based on the training I had at the time, I wasn't the person that could meet all of those needs. And I often found that when I talked to other teachers in my school, my principal, or looked into the community, there was just a lack of resources or information for parents about how to get those services. And so it's something like the Balmer Institute, we're getting in there, we're becoming involved in schools, which means we're creating access and equity when it comes to the supports that we need. And that's only going to benefit the entire state of Oregon.
At this time in Oregon's history, it's absolutely essential that we diversify the behavioral health care workforce, and the Balmer Institute, along with its partners, will enable us to do that. Our schools, our elementary schools, our middle schools, our high schools, are key access points for families needing behavioral health supports for their children, and this is particularly true for our families of color. We know that the challenges that we face are extraordinary, and we know that not one entity can solve these challenges alone. We can all have a much greater impact by working together with the Balmer Institute, with Portland Public Schools, with the state of Oregon, all coming together to both expand the capacity and grow our professionally trained workforce.
I think something's happening in our industry that's very different. I think donors are asking a fundamental question, which is, can philanthropy drive an institution to more direct impact in society? This gift, this opportunity is truly unique and remarkable, and I think strikes at the heart of our mission as a public research university. The Balmer Institute for Children's Behavioral Health will not only bring world-class research and amazing teaching through a new undergraduate degree program, but will be directly impacting the lives of students in schools every day. This gift and this opportunity intends to make a bold and audacious step in taking on the challenges of children's behavioral health.
As a mom of 2 children, I am deeply committed to improving the lives of children in our state. I envision a much rosier, brighter outcome for our state with the Balmer Institute and with this incredible gift.